students, right here, here's Mrs. Cortez's room. Want to knock? Hi, Mrs. Cortez. I'm Patty Donahue, your nurse. Do you remember we talked this morning that I was going to bring my students by to meet you?
Yes.
Here's my students. Thank you for letting them come in and watch us give your medications this morning.
My
Okay.
pleasure. Thank you for
First, what we're going
coming.
to do, students, is we're going to put our medications down in our MAR, making sure that you bring the MAR with to perform your third check on your medications. Before doing any patient care, we're going to always wash our hands and provide the patient with privacy. This is our right patient. So we're going to look with our MAR at her armband. Maritza Cortez, date of birth 6/30/1970. Maritza Cortez, date of birth 6/30/1970. Okay. Mrs. Cortez, I'm going to raise your bed just a little bit if you don't mind.
Not at all.
Have it up a little bit. Okay, and then I'm going to raise your head up a little too. Can you tell me, Mrs. Cortez, if you have any allergies?
No allergies.
All right, because you know, doctor is starting you on a new antibiotic, so I want to make sure that that's safer to give to you. All right, so students, regarding her medications, one thing that we needed to do prior to giving was check Mrs. Cortez's pulse, apical, because she's on digoxin. And in checking an apical pulse, you want to make sure that you check the pulse rate for 1 minute. So we're going to go ahead and do that. I think it's always good for infection control purposes with whatever equipment you use to clean off prior and after to patient's use. If it's a piece of equipment you use patient to patient. In checking the apical pulse, we want to go skin to our stethoscope. I'm going to just listen, lift up your gown a little, Mrs. Cortez. And we want to go apical, so finding the apex of her heart. And we are going to listen for 1 minute. Okay, very good, Maritza. Your apical heart rate is 78 and very regular. That is great. So we can give Mrs. Cortez her medication because her pulse is above 60. Mrs. Cortez, do you like to take all your medications at once, or do you like to take them individually?
All at once.
All right, very good. We're going to get you some water. And we have identified that Mrs. Cortez doesn't have any swallowing issues, and she is not NPO. Okay, we're going to perform our third check prior to giving your medications. And then we will open them. So first we have the Lasix, the 20 milligram tablet, and 1 tablet. We're going to pop it open and put it in her cup. Dispose of the wrapper. Potassium chloride, 20 milliequivalents. Potassium, 20 milliequivalents. 1 capsule. Pop it in and throw the wrapper. And now we know we can give the Dig, 0.25 milligrams, 1 tablet. Pop it in and get rid of the wrapper. And we have our Augmentin. I'm going to pour you some water, Mrs. Cortez, and then I'll hand you your pills. Here you go. And some water. Do you need some more?
No.
Very good. And now your Augmentin. Your water? Is that good?
Mm-hmm. Thank you.
Okay. In talking about your medications, Mrs. Cortez, your Augmentin, this is a new antibiotic doctor started you on for you have a little bit of a respiratory infection. This medication may upset your stomach, may make you a little crampy, or change your stools to a looser stool. So if those things are occurring, you want to let us know. Some patients, students, don't really tolerate certain antibiotics well, so we would want to make sure that we knew that and notified physician if Mrs. Cortez was having some problems with that. Mrs. Cortez, you're also taking Lasix. Do you know what this medication is?
Yes.
Can you tell the students?
Well, it's a diuretic, and that means that it causes me to release water, and it keeps my swelling down, and it has something to do with my heart, but I'm not exactly sure. I just take it.
You are very knowledgeable, Mrs. Cortez. When there's too much fluid on the heart, that's a strain, so we want to get those fluids diuresed off. So doctors put you on this Lasix, and you're responding really well to it. And you are exactly right, student. She knows a lot about her medications. Doctor also has you on potassium, which is a supplement. Because you're on the Lasix, doctor wants you to take this potassium supplement to make sure that your electrolytes don't get up. So we'll be monitoring and doing blood draws on you to check, to make sure that your potassium level is good, as well as your other electrolytes. The last medication, Mrs. Cortez, is your digoxin. And this medication is for your heart, to regulate your heart rate, and that is why we check your pulse, to make sure that your heart rate isn't too low before giving that medication. Now with your Lasix, you know, that may make you have to go to the bathroom more, so if you need some assistance, you give us a call and let us know. Is there anything else we can do for you before we leave you, Mrs. Cortez?
Will you just turn off the TV?
I would love to. Okay? And I'm going to reposition you. I'm going to put your bed back down, Mrs. Cortez. And also, would you like to go flat or sit up a little bit more?
No, I like sitting up. Thank you.
Okay. Here's your call light. I want you to make sure that you call me if there's anything you need. I'm going to put your bedside table a little closer to you and leave you with some water. And I'm going to open back up your curtain. And then, as always, we want to make sure that we wash our hands. Okay, Mrs. Cortez, I'm going to be back to check on you in about 20 minutes to see how you are doing. Okay, students, we're going to progress out to the nurse's station and finish our documentation there. Okay, back at the medication cart, we're going to document in our MAR record. We're going to document off on each medication. Going along by the box, we're going to make sure we put today's date and our initials next to each medication. It's important by the digoxin that we record the patient's heart rate, which we are going to put on the line below our initials. At the very bottom, we're going to put our initials so people can know whose initials these are, and our full name and our title. So that's what we're going to do right now. Documentation, remember students, Dr. Tim, the last D being documentation. At this point, this concludes the PO medication return.